Welcome to the Women in Digital Dentistry podcast, where we empower through innovation. I'm Allison Lacoussiere, your host, and each week we'll explore the mindset and the skill set of creating a successful practice and life for women in business. From the latest in dental technology to mastering marketing strategies, creating team synergy, cultivating a powerful money mindset, this podcast is your resource to empower yourself and your team to have the most success possible. Whether you're an established business professional or just beginning your journey, we're here to help you unlock your full potential, lead with confidence, and have an incredible journey along the way. Welcome to the Women in Digital Dentistry podcast. Welcome to another episode of Women in Digital Dentistry. I am here with the incredible Dr. Lovedeep Randhawa. She is our provincial leader for British Columbia. Welcome to the show.
Hi, Allison. Thank you so much. It's been an incredible year. Seriously, what a journey with our Women in Dentistry, digital dentistry movement. So proud of being part of it and so glad to be here today.
Oh my gosh, I'm so excited to have you here. I will introduce you in my perspective, and then I'm going to tell our audience who you are because you've done so much in our industry, and I'm just so infinitely inspired by you. So I got to know Lovedeep through a recommendation from Align Technology. I asked, please introduce me to the top female clinicians in Canada. And they sent me an introduction to Lovedeep. And immediately I shared with her the vision and the mission behind Women in Digital Dentistry. And she was a hell yes. How do I support? How do I be involved with this? And from that day forward, she has brought so much energy and light and enthusiasm and encouragement to the women in our community. She has brought her team to the Align headquarters to be trained. She is just an incredible human around. So, Lovedeep, I've just loved getting to know you over this past year.
It's been my pleasure. I have learned so much. It is amazing the energy when we get together in our in-person events and on our online events. Just being in with such strong women, it's just amazing. There's so much to learn from each other, and the love and support that is in this group is just amazing. It's incredible. So I'm privileged to be part of it.
It really is. It really is. And I was smiling because I was just imagining all of the provincial leaders walking in and truly like you guys look like you ladies look like supermodels just walking in and like these powerful women. It's amazing. So let me tell you a little bit more about Dr. Lovedeep Randhawa. So she's a 2004 graduate of the Faculty of Dentistry, UBC, is an aligned KOL and speaker, platinum Invisalign provider, and the provincial leader for women in digital dentistry. She has been an early adopter of digital dentistry and has built a highly successful and fulfilling practice. And she's so passionate to share her journey. And she spent the last 4 years lecturing all across North America. So she has an article and a white paper in the Align Oral Health Suite, and her Invisalign cases were published in the 2021 publication of the Invisalign Gallery, which is a big deal, by the way, because they put a lot of people submit cases. So the fact that you have that is incredible.
It was very humbling.
I'm so proud of you for it. So she also has been nominated for the RBC Canadian Women Entrepreneur Awards presented by the Women of Influence and is actively involved in various philanthropic initiatives. She enjoys traveling, learning, spending quality time with her family, and she's committed to patient education. She and her team empower patients to discover their true potential of their smile. So, you're just incredible. Thank you for being here.
Thank you for having me here, Allison.
So, let me ask you this question.
Mhm.
Why were you an early adopter of digital dentistry? Like, what made you interested in that?
I think I'm always so eager to learn. I'm just like, okay, what's next? It's like, I don't know if I'm a restless person or what, but it's just like as soon as I've learned something and I'm like, okay, this is great. This is, I can do so much with this for my patients, for my team, for my family, for my community. It's just like, okay, now next. Like, it's just let's learn more, let's do better. Because you know what? Life gets boring if you're not learning, if you're not growing every single day, right? So I think in early 2000s, I was still trying to really hone my skills as a dentist. That was the time that I was not only associating, becoming a partner in the practice, also having young kids. There was a lot going on, and so once I was like, okay, I'm comfortable now with dentistry, general dentistry as such. Now I need to know what's out there, and digital dentistry was just kind of becoming something that we were hearing about, and I was just like, okay, let's do it, because you know what, you change is coming. And so if you're going to hold so well, this works in my hands and this is it, I'm going to just stay with it. I don't think, I think that'll stand in the way of your progression. And so that change, it was inevitable. It was happening all around us, right? It was happening from our phones to our cars. Like our cars were drive assist. They were telling us there's a vehicle, you're too close to the vehicle in the next lane. Our
Yeah.
phones, from pagers, we were going to not flip phones. Now we had phones that could take pictures. Like so much was changing. And digital dentistry, I knew, was just going to be the next big thing. And I wanted to learn and see how I could bring it to my practice. And by 2012, we were fully digital in the practice. So that was amazing. It was a little scary, but it was so exciting. And I'm so glad we did it. And, we're still learning, we're still growing.
Oh my gosh. Like something that you said that I want to like dial in on is like change is always really scary and it's really truly kind of excruciating. And even our brains don't want to change because we're going through this repetition that keeps us safe. It keeps us in familiar territory. And so when we make a decision to risk going and trying something new, which we know is necessary and beneficial, it's hard. And so, how did you overcome that? How did you have that kind of courage, that foresight, and then discipline to make that change?
It was just understanding what this could do for me personally and career wise, right? So any change that once you evaluate what it can bring for you, what you would have to input to get that, and do you have the support for that from your immediate team or family, or your group of friends, then it's easy. It's like it's for anything. It's entering a relationship, hiring a new associate, hiring a new team member, right? It's everything. You have to kind of do your homework, see if it is the right fit for you at that time in your life, and then you go for it, basically, right? And so it was just that, like, I knew it was going to bring predictability and efficiency to my practice. And once you kind of you get comfortable with the procedures, you know how you can handle a lot of procedures that you want to do at your practice. The next element now is, how do I make them more predictable? How do I make them efficient? And how do I go to the next level of dentistry, right? And for me, I think with digital dentistry, that was just the way to go. And there were a lot of resources around. I know we were still kind of analog, digital. I did Sphere curriculum. I'm now doing quiz. And the other thing is, Align was very helpful. The training and support that Align provided every step of the way was really, really awesome for me. So I think just knowing that this is what I wanted to do, getting my team on board, and then just really committing my time and energy to it, that really paid off.
Oh my gosh, I love it. I love it. And I know the women in our community have learned so much from you because you have this fierceness about it. Like you're just like, this is what I do. This is who I am. And being able to see you do that and like lead in that way is so powerful. So thank you for being such an inspiration to so many people because of it. One of the things that I know that you have gone through a transformation this year is leadership. Like you have like up leveled your leadership skills. You have stepped into this like higher, just beautiful essence of leadership. Tell me, what was that journey like and what is life like today because of it?
So we're very small business owners. Our teams are small. We work in such close proximity with everybody, and it's really intense profession, right? So our relationship as a team is actually quite close. And so I always thought I was very supportive of my team. I always wanted to tackle the issues right there and then, not let them just fester and get big, and cause an environment in the office where people did not want to come to work next morning, or were getting anxiety. Oh my God, I have to go to work. I always wanted to have an environment, which I was lucky enough to always have in my practices, that people actually enjoy coming to work and enjoy being part of that team. I think this year, especially because of women in digital dentistry and the leadership training and support that we have gotten through this network, it really gave me the confidence that I can be a great dentist. I can be a good mom and a wife. I could be a speaker. I could support my colleagues, and yet I can still be a strong leader. A lot of times leadership was where I was a little bit like, how do I bring it up? I was just so diplomatic, so gentle about things. I still am. Like, I don't want to hurt anybody's feelings, but at least now I am at that position where I can recognize things, which I did in the past, but sometimes I didn't do anything about it. Now it's just like, okay, this is what it is. Team, let's get together. If this is the problem that we have or an issue, or this is the improvement we need to make, I want each one of you to bring me solutions. This is what you want to change. Give me solutions. What are your suggestions? It empowers the team because team goes, okay, well, we're valuable in this practice because we're not just coming, doing our work and going. We are actually part of building this practice, right? And for my team to see my growth as well, being on stages, GP Summit and Pacific Dental Conference and local study clubs as well as at Align headquarters, it also kind of made them understand that okay, well, there's more to her, and
Mhm.
we want to support her, and we are also part of it. And that's the other thing I always tell them. I go, I can do this because you guys got my back. You guys got the practice office covered when I'm traveling, and that's huge. So I think this year empowered empowered my team. My team now, rather than having those 10-minute huddles that we used to quickly have, or weekly 1 hour meeting that really sometimes wasn't resulting in something solid, we have started to implement 2 to 3 hours a month where we are doing it. Could it be team training? Could it be just something fun? Could it be relationship building? Could it be where we are setting goals for the next 3 months and coming up with solutions as to how to do it? So that was the journey that I'm so glad I took. And the confidence coming in, that we were all talking about the imposter syndrome, right? When people were
Yeah.
coming up to me and I'm like, okay, they want me here, but like, why me? Like, what? And you know what? A lot of the times you put your bio and then you shorten it because you're like, I don't want to sound like, I'm this and that. And so I think that confidence that I got during this year really helped me say, no, why not? We worked hard to be here. I want to be visible. If I'm visible and if I make my voice heard, I can make a change, right? And so that's the same thing I've said to my team. You guys want to make yourself visible. You want to, voice your concerns, and guys want to bring me solutions so that I know how valuable you are to the team and to the office and patients. And I think that's where we are growing, and it's so exciting. Everybody is so happy, so full of energy, and they just think that there's nothing stopping us now.
Oh my gosh, that makes me so happy. And it is like, it's hard sometimes when you are like, you are the definition of a high performer. And even though, like I say that oftentimes when I share what's true for women, we can be like, oh no, 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 like not really. If you only knew what my closet looked like, we always have these excuses to like dim ourselves. And
Yes.
we've learned over this year that there is definitely like a neurobiological reason why we do that because being seen in a big way previously for women wasn't safe. Like we weren't safe to be seen in these expansive ways. And so we have this tendency to like minimize ourselves like, oh, I love your dress. Oh, I got this on sale. Or like,
You look great. Oh my God. Yes, I just did this right now. It's fine if you did this just now, but own it. You're beautiful. Somebody's giving you a compliment, right? So yeah, you're right on the money on that. Yeah.
yeah, and it's incredible though when as you've seen when you've like shifted that you're like, wait a second, no, like every single thing that's on my bio is what I've earned and what I've worked for and the hard work and investment and time and effort that I put in. So you deserve to stand in it and to own it. And when you do that, it actually doesn't make people like you less. Like, oh, look at her. Not at all. It makes your team and all of the women and all the people around you respect you even more and be inspired by you even more. And so I know because I got to meet your team and hear their thoughts and their like words about you. They're so inspired by you and they're so committed to you. And that's exactly what leadership presence is that they just adore you and they want to be able to support you in bigger and better ways. And that's how we get a high performing team. So it's so exciting to see.
It truly is. Yes.
So, what one of the things that I've also noticed about you is that you have a deep passion for supporting women and like literally everybody, but women specifically. And what has caused you to have such a deep like commitment and passion to supporting women?
Oldest of three sisters. And I'm born and brought up in India. We grew up in India, all three of us. And it is a society, especially back when I was born in the 70s, and even, when my sisters were born in the 80s, that it's a very male preferred society or male dominated society. And a lot of it, even parents thought, okay, if I have a son, I'll have somebody that will take care of me when I'm older. And a lot of that education and a lot of those aspirations were for boys, like my son has to get this job and, this education, support. My father always actually pushed all three of us. He was such a big supporter. Like seriously, I'm going to get emotional just even um, I couldn't have done any of it if it wasn't for the support my parents have given us. During those times, my dad sent us to the best schools, best colleges, best universities possible. He sent me to Canada and US to do my further education, and for nothing expecting in return. Like he didn't expect anything in return. The only thing he always taught me is everything else people can take from you, or you could lose, like if you have money or property or something, but education is one thing that you can never lose, right? You get the more you learn, the more capable you're going to get, and more opportunities are going to be out there for you. I think just seeing that, and just seeing that how lucky I was to have that support, I want to support anybody and everybody, whichever way I can, because if I didn't have that from my parents, if I didn't have, when I came to Canada, the support that I got from my teachers, the support that I got from the very first dentist that hired me. And funny thing, he hired me, then he made me a partner, then he sold me his practice, like, and he still supports me even though he's retired. Um, all those people, if they really didn't believe in me and see my potential and support me, I wouldn't be here. I didn't know any better at a young age, right? So today my whole goal is to pay it forward. I was lucky enough to be supported by such amazing people, and to be so lucky to be married to the husband that I am married to, and the kids that I have, and the wonderful team. I think I got a lot of good things in my life, and I just want to pay it forward, just want to help anybody and everybody, may it be with my charities, may it be with my speaking, may it be with, when dentists call me and say, can you help me with this clin check? Can I just share this? I'm kind of stuck on this case. Yes, no problem. When are you available? Let's do a Zoom call or a WhatsApp call, and we can work through it together. Because I think other thing that I see in my profession is I'm limited as to how much I can work, right? I've only two hands. There's only so many days in a week. If I can help any other dentist even improve or learn something that will improve their patient's experience, that is more patients that we can help, right? So it's just the further reach of our profession, providing that good healthcare that we are supposed to be providing to our patients. So basically that's really it, right? It's not, it doesn't cost you anything to be nice or to be supportive to people, right?
Oh my gosh, I love that so much. So a lot of the women in our community and in our network, we have all dental team members, we have dentists watching this podcast. If you could give them your best advice, like let's say it was you at the beginning of your journey, or you before you learned all the things that you've learned in order to be where you are today, like what would be your top advice for women in our profession to help them get to the level that they want to get to?
First of all, don't sweat the small stuff. You're going to be okay. Everything's going to be okay. We get so caught up in the things that happen on that day, sometimes a tooth extraction that didn't go the right way, and then we get so anxious about it and say, okay, I'm never going to do extractions anymore. A crown and bridge work done that didn't go as well, maybe, a miscommunication with the lab or something, and getting anxious for the next time. If I'm going to do it, how am I, like, should I do it or not do it, doubting yourself. Don't do that. If they're never get so discouraged by something that you give up on it. I've always done one thing that I've done is if something didn't go well, like, okay, it didn't go well. Let's figure out why. And let's make sure that doesn't happen again. CE, asking help from colleagues, just anything and everything I could do to better myself. And if down the road I realize that procedure is not something really I enjoy doing, that's totally fine. But
Yeah.
that's your choice that you decided not to do that, right? You didn't let something that didn't go right bring you down, right? Other thing that I would say is CE. That just, I know we are supposed to have some amount of CE to maintain our license. I literally, whenever I remember to fill that form on our the CE list, it just fills up within like 6 months or something, and I'm supposed to do it in 3 years, right? It's I've spent hundreds of hours, sometimes in a year, to do CE. I have followed the best speakers out there, and it is a good investment. Sometimes I feel like I tell my husband, I go, this is my vacation. Like, this is me time, because I love being surrounded by brilliant people. There's so much knowledge that they impart. There's so much you can bring back to your practice. Yes, you might not be able to, get all that into your practice the very next day, but over time, yes, it will be one of the best investments you will make in your career. And the other thing is, give yourself a pat on your back. It's just, you do a lot. You do a lot. Take a breather and say, I did the best I could today. And you know what? It's a lonely profession. So if you don't stand up for yourself and you don't give a pat on your own back, there might not be many people around you that would. So you're doing a very hard job that is not easy to do. So kudos to you for doing it.
Oh my gosh. Yes, yes, yes to all of those things. It is so important. And it's one of my favorite things, like being at the CEC in Toronto with all of the women that are a part of Women in Digital Dentistry, is when I watch everyone get together and like celebrate each other. And that's really something I think, like you said, it's a lonely profession and it's hard sometimes. Like you do an incredible procedure, but like your team sees it, your patient doesn't really see it. And then you're like, okay, well, I guess I just broke my back for that. But like you really do have to learn how to acknowledge yourself. But
Yeah.
when you're in a room with other like-minded female clinicians, you can be like that case, that job, that practice that you built, like this, it resonates so much deeper because they understand what it took to get to where you
Yes.
are.
Yes, and that's the human part of it, right? It's when I lecture, I show the good, the bad, the ugly. I show everything. I use an iPhone to take pictures. It's just like, it's not like I have a huge setup to take pictures. I show everyday real life things that I do. Not every time everything's perfect, right? And there are vulnerabilities for all of us, and just if we are open to kind of sharing that with each other, so that everybody understands, even when we are on these big stages and we're leaders, it's we don't always get it right. Right, so we're humans, so it's okay to be human. Don't be so hard on yourself every single day.
100%. And if every woman watching this podcast could like embed that into themselves and to like just give themselves a little bit more grace and a little bit more celebration, I think we would all have more fun. Our work would probably be even more productive just because we're not giving ourselves that hard time. So I love it. Lovedeep, what does the future hold for you and for like even women in dentistry? What do you think?
Oh my God, I remember the conversation that we had when Carla Soto was there, Deb was there, you, Andrea, myself, Corrine, all of us were chatting, and it's just like, I want this to be Canada wide. I want 500 women. I want 1,000 women, right? I want that women have this incredible capacity to love, support, give, nurture. Um, and they're so good at what they do, but regardless of what the profession is. But in dentistry, they nurture their teams. They so compassionate for their patients. They are such good moms, wives. Like, they try to hold everything together, and they do so much in every aspect of their life. How incredible would that be if we had all these women that are doing this day in, day out together, to celebrate, to tell each other, high five, you know what? We're doing this every single day, and we're not alone. We're all together. We are in this together. I think that's really my dream, is how many people can we support? How many people can we empower? How many people can we reach and listen to their stories and
Mhm.
share something of our story that resonates with them, and say, I was there. I had something like that happen, and this is how I resolved it. And that exact solution might not work for them, but just knowing that we went through it, we came out of it, and we are looking forward and marching on. And I think that's really a lot of support, a moral support, that would do great, especially in the times that things are not going so well in somebody's career or life, right? So I think for me, more women in dentistry, more dentists as such, more dental professionals that we can support and help, learn from, and empower is where my goal is. So let's just go. Let's just get everybody involved.
Oh my gosh, I have goosebumps and I'm so fired up by this. And I 100% agree. We are here to support and uplift and love on, like, my absolute goal is that every single time a woman leaves, even just a small experience that we have or one of our great events, is that they just feel so poured into and loved on because they deserve it and they need it. And we get to do this for each other. And so, Lovedeep, I just want to honor you and acknowledge you for the work that you've done, for being who you are. Like, you are so authentic. You're so powerful. You're so beautiful. You're so much fun. And you bring such a light and a life to women in digital dentistry. You are such a powerhouse. And I just cannot wait to see how many people you influence, that you support, and that you help just by being exactly who you are. So thank you for being a leader in women in digital dentistry. We're so lucky to have you.
Thank you so much, Allison. You know what? Sometimes when I'm with you guys and we praise each other, I tell my husband, I said, my head is too big. It's not even going to fit through the front door. Forget about the garage door, right? But I think the other thing is my heart always grows a few sizes bigger when I'm in those events, right? And even talking to you guys, like a quick phone call or a chat with you or Kareen or Andrea, it's there's so much love, there's so much generosity and genuinity in this group. And I am just amazed at what you have created, and how much you have empowered us, and how much you have taught us about leadership and team systemization. Like, it's literally, where you kind of actually you recognized where we needed that help, and you've supported all of us, the leaders, in that, and really given us a lot of tools. So I really appreciate you. I thank you. It's an incredible movement that you've started, and I'm so honored to be part of it. And I can't wait to see this get bigger and bigger and bigger and more successful. So thank you so much, Allison. I appreciate you.
Thank you. Oh my gosh, you're such a gem and I appreciate it so much. So thank you for all of you who are listening to the Women in Digital Dentistry podcast. If this resonated with you, if you have a friend that this would resonate with, please share it. Please share this movement. Please go and follow Lovedeep on social media. The link for her handle will be below. Follow Women in Digital Dentistry and join us at our next live event, December 6th. We will be so excited to welcome you to our community. So we will see you on another episode of Women in Digital Dentistry. Thank you again, Lovedeep, for being our
Thank you
fabulous
so,
guest.
thank you so much.
Bye.
Bye.
Thank you for joining us on this episode of Women in Digital Dentistry. We hope you found today's discussion inspiring and full of actionable insights to help you thrive in your practice and beyond. If you enjoyed this episode, please be sure to subscribe so you never miss an update. And if you know someone who would benefit from these conversations, please share this podcast with them. We would love to hear your thoughts and feedback, so feel free to leave us a review or connect with us on social media. Together, we are building a powerful community of women leading the way in digital dentistry. Until next time, keep innovating, keep growing, and keep making a difference in the world of dentistry. Thanks for listening.